Well, good afternoon, everyone, and thank you for joining us for today's discussion on the resources available to you as we continue to combat the coronavirus pandemic. I'm grateful to be joined today by the incredible leaders of Community Teamwork, a community action agency that provides services to strengthen communities and reduce poverty in the greater Lowell region. Before I introduce our incredible panelists, I'd like to briefly give everyone an update on where we are in the fight against COVID-19. Right now, Massachusetts is in phase 2 of reopening, meaning we have hit thresholds to continue the process of slowly getting back to a sense of normalcy. But to date, 107,000 people in the Commonwealth have tested positive for the virus. Nearly 89,000 have recovered. And sadly, we've lost 7,900 people to the virus. These numbers are daunting for all of us, and each one represents a personal story of either triumph or tragedy. The number of new cases and hospitalizations has been declining, which has allowed us to reopen certain businesses and begin to gradually leave our homes wearing a mask. However, much of the economic devastation created by this pandemic remains. Tens of millions of Americans are still out of work, and their bills are piling up. As Congress continues to push the Senate towards the negotiating table to get another round of relief passed, it's important that you know what services are available to you and your families through incredible organizations like Community Teamwork. For those of you who haven't worked with them in the past, CTI has been a staple of Greater Lowell since it was founded in 1965 with the mission of reducing poverty by delivering vital services and collaborating with key stakeholders to create opportunities in housing, education, and economic development. CTI is the second largest community action agency in Massachusetts, one of a network of 23 human services CAAs across the Commonwealth who provide support to the most vulnerable. In 2019 alone, CTI provided assistance to more than 54,000 people in 63 towns and communities in Middlesex and Essex counties. I'm hopeful that this conversation will allow you to help even more folks in need, especially as we continue to rebuild our economy and get people back to work. I'm proud of the progress that we've made getting organizations like CTI additional funding for their programs and make them available remotely during the coronavirus pandemic. In fact, in the CARES Act, we were able to secure $1 billion for the Community Services Block Grant and an increase in eligibility to 200% of poverty. That eligibility increase was a big priority of Karen's and her teams and why we pushed so hard for it. $3.5 billion for the Child Care and Development Block Grant, $750 million for Head Start programs, and $900 million for LIHEAP. Securing even more federal investments in community action agencies remains a top priority of mine as we continue our work to get another relief package through the Congress and signed into law. So with that being said, I want to thank you again for being here with me today, and thank you to the folks who are tuning in live. I'll turn it over now to Karen Frederick, the Chief Executive Officer of Community Teamwork and a dear friend who can tell us a little bit more about the organization's work and introduce our expert panelists.
Thank you so much, Lori, and I am so grateful that you are my Congresswoman and that we work closely with you and your office and for all of the resources that are coming from the federal government and from our partners in state government and from our local government partners as well to deal with the effects of COVID-19 in our communities. And as you said, we've been doing this work a very long time and are really positioned well to deliver resources quickly in our community. And I want to tell you a little bit about why that is. So we've really revamped our organization over the last probably 5 years to be an organization that people can come in any door and we have a holistic look at the needs of a person coming in. So because we do housing, which is Carl Howell's division, and homeless services, and we do early education and care in Megan's division, and in Connie's we do fuel assistance and nutrition assistance, and all of our resources come together in our community resource division that Connie Martin oversees. So a long time ago, we really decided that we could always run individual programs and help people, or we could really help people define their pathway forward in life and help them meet the goals that they chose for their own families. And that's really the path we've taken. So when people come in, we look at an integrated, holistic approach to the needs that people have. We do a brief assessment of needs, and then we really help them link to the services they need. So for our traditional services, people can come in and get fuel assistance still and get on. We're doing it all remotely. But they can also find out what are the other resources that we have in the same call and what their eligibility is and what will help them. And we know COVID-19 has hit our communities hard with unemployment, with people struggling to run their businesses, with lack of access to education. And we know there's a disparate impact to the results of COVID-19 for our very low income people. They didn't have tablets and the tools to educate at home. So we quickly got some of those resources out to people. So our job is to really look at the community needs and act, and to be a catalyst for social change. And we really take that part of our mission very seriously. So as new resources have come in, we've been able to very quickly ramp up. We've had the capacity, and every time I have the opportunity, I thank our IT staff, because they had already helped us get to laptops and tablets that people could take home. They very quickly transitioned us to remote work. So all of our services kept going, and they're still going, and we've added additional resources to it. So we want to make sure that people know we're here, that people of even a higher income who we were not able to help before, we can help them with the new resources that have a higher income level. And in some communities where we have not had as many needs, there are more needs. And we want to make sure we link with those people. So we want to make sure we're accessible, that people know our services, and that they can access them easily. So we're very grateful to have this opportunity to talk to you and to the public about how people can access and what our services are.
Terrific. So can I just launch right into the questions?
Absolutely.
You know, I've been amazed at how agile you've been. And, you know, I grew up sort of watching CTI just deliver unbelievable services to the community and well beyond Greater Lowell. But I'm wondering, because sometimes we use the acronyms, or we take for granted that people know exactly what services you provide. Could you just give like an overview to folks of the types of services you provide, and then how are you uniquely positioned to respond to the coronavirus pandemic?
So do you want to each do it, or do you want me to just do an overview? What makes the most sense? Maybe if you each talk about your division services, it will kind of give people the overview, and then I can kind of bring it back to how we're positioned. So Carl, do you want to start with housing and homelessness?
Sure. So services we provide in our division really focus on homeless prevention, rehousing, and stabilization services for individuals and families. That's broken up into, I would say, 3 different departments. Our first department that I talk about is our emergency assistance shelter for families. And so we serve 127 families in the Commonwealth, providing them emergency shelter, case management, and supportive services to help rehouse them using various state funding as well as private funding. Then along that continuum, we also do permanent housing, which is subsidized housing, Section 8, and Massachusetts rental vouchers. We have about 3,600 to 3,700 vouchers across the Commonwealth that we administer and provide supportive services to. And then our third department is our youth services. And in our youth services, which is our newest department, about 2 years old now, we basically provide emergency assistance to youth that are in transition or in crisis. That would be 16 to 24-year-olds specifically, that we provide rapid rehousing supports, case management, food insecurity supports, and just kind of some guidance. Underneath that umbrella is also our youth build program, which the community might be very familiar with, that provides vocational leadership and educational training for our youth, again, 26 to 24 years old, where they walk away with a high school equivalency, as well as certification in a specific trade that we primarily focus on is construction and culinary arts.
And Megan Sembor does our early learning division. So Megan?
Yes, so in our early learning division, we service approximately 1,400 families across the greater Lowell area through a mixed delivery system. We have school age programming. We're in 7 school age sites. We service approximately 500 children. We have a family child care system through which we service approximately 300 children. And then we have our early learning center-based care, which services approximately 600 children. The children in center-based are 0 to 5. It's also our Head Start and Early Head Start programming. And we do have home-based early Head Start home visiting services as well. So we do provide transportation to all of the children in our programs. You know, we really do look at, you know, the full comprehensive service approach to supporting our children and families. It is early education and care. However, all of the assessments and work that Karen has already referenced, you know, we are consistently working with our families. You know, if we're supporting those families, then those children are going to get off to the right start. So we're making sure that we're supporting them with all of their health needs. We're supporting them with transportation, as well as we have our own kitchen and are able to provide full meals and nutrition services to all of the children in our programs.
I've seen some of them.
They're beautiful centers.
Oh, they're beautiful.
And as Megan knows, you know, we believe when families do better, children do better. So that
Absolutely.
is why it's a holistic approach to the entire
Absolutely.
family. And
That's right.
Connie Martin is our community resources leader, and she can tell you about community resources, and you can do you're the glue that hold us all together, right, Connie? So you can do the how this all, why we're positioned.
I can't pull off that. But as I do say, you know, within the Community Resources Division, we really are, the programming that we offer really takes families as they connect through the Housing and Homeless Services Division, through Child and Family, and we kind of provide many of those wraparound services that really are, you know, kind of once a family is stable, these programs are able to kind of help them take those next steps forward, as Karen mentioned, kind of in their own way and based on their own goals. When we talk about some of the specific services, our fuel assistance programs, weatherization programs, both federally funded, very appreciative of the increases to those funds. You know, and those are the ways that we're able to keep, you know, we have upwards of 10,000 families that we can keep safe in their homes during the winter months. We also provide that service all year round. So that's one of the kind of key bricks that we can use for building these supports around families. Our WIC program, also federally funded through the state government, you know, providing nutrition services, nutrition education, as well as actual food security for children from 0 to 5. Has, you know, servicing, again, our program alone is at about 5,300 children who receive those services at that critical time of life where those investments in nutrition really have a huge impact. And then we get, you know, we have, again, a kind of range of services that we build from there. Our Financial Education Center has interplay with all of our different programs, working to ensure that families are making the best decisions for themselves. You know, we have certified credit repair specialists, we have student loan specialists, we have individuals who've gone through training for behavioral social work based on financial decision making, so that as we're doing our one-on-one budget counseling and helping people make those choices, they have the most current up-to-date information. Our volunteer center, which has been part of the agency for over 50 years, it was one of the founding programs of community teamwork. We're working with over 350 seniors who are volunteering in various aspects throughout our community during this COVID experience. It's really been more about us reaching out to them and being able to provide food supports, being able to provide it's certainly very limited in terms of socialization and connection. And these are things that our seniors really, really rely on. So staff has been able to move into that role and being able to keep those connections, which has been incredibly satisfying. And I know from our seniors has been very appreciated. Our Housing Consumer Education Center is that key place where our housing supports and the emergency supports come in, where we're working to rescue tenancies, working to, again, rescue mortgages, having a variety of different funding sources that we can apply based on the overall family need and family situation so that people are staying safe. We recognize here in Massachusetts, we've had the moratorium in place where no evictions can take place, but everyone recognizes that as that moratorium comes to its end, people are going to be left in a situation where they have back rent that will just seem even more impossible to pay now. So we're working very hard with families and clients and individuals to ensure that they're taking the steps to protect themselves moving forward, keeping themselves stable. And then kind of the final kind of umbrella under which all of this happens, everything comes through our resource center. Again, as Karen mentioned, ensuring that people can connect with any one of our programs through this one portal. Making the move to virtual services was, I think, perhaps even the most important for the resource center, because it's been the key place where staff have been able to, clients are able to connect, go through what has always been our pre-assessment process, which is really where that comprehensive, holistic understanding of a family comes from. The idea that we've been able to do that with staff kind of flung across the Merrimack Valley, using all these new virtual methods, and yet still being able to make that very personal and critically important connection, I think has been one of CTI's real victories. We've been just really impressed with the way we've been able to maintain that and the staff work in making that happen. So that's kind of the key place where everything gets tied together, where clients and families can connect with, if they're, childcare, housing, all the different fuel assistance, all the different programs kind of get knit together. Let's say woven together because we're here in Lowell, but woven together and to really provide that safety net for families.
That's tremendous. And I'm, so many people, they don't, even when we're picking up the phone in our office, so many times people just don't know who to call or what resources are available. But once they've reached out to you, whether it's for childcare or for housing, you introduce them to this portfolio that is, it's life-saving, right? I mean, it's just incredible. So Megan, I wanted to ask you, we know how vital childcare will be in the reopening of our economy. How are you approaching the reopening of childcare centers, and what are you seeing in terms of the needs of your families? How can CTI help?
Yeah, so 96% of our families currently enrolled are ready to start. We've started with the outreach. We've been connecting with our families and doing virtual learning throughout COVID, and 2 to 3 times a week, making those connections and seeing what they need. The job loss, the loss of being able to participate in their education programs. I mean, it's astounding what's happened, and we do have 96% of our families ready to come back. So what we've done, we've really started by really researching, looking closely at the guidance from the CDC, from the Department of Early Education and Care, Department of Public Health, and have revamped a lot of our policies and procedures. Unfortunately, we aren't going to be able to reopen at full capacity. However, we will continue with remote services for families. Home visits, we're working to do remote home visits for our home visiting program. And continuing the remote learning, but for the children that we can bring in, it's a balancing act. We're coming back, keeping infants and toddlers and preschoolers 6 feet apart, socially distance is so counterintuitive to everything we do and what we know is right for children, you know, in that nurturing environment. So it is a balancing act of keeping safety standards in place while also creating a nurturing environment that's going to support all of their social emotional growth. You know, and I think another focus is the reality. This time is very hard. These last 15 weeks have created a lot of stressors for our families. So ensuring that we have enough supports in place, mental health supports or, you know, resource and referral supports to get those families back up and running. So we have been very focused on securing PPE. You know, we're trying to have a good stash. Hopefully we think what might be a 3-month stash so that, you know, it's not just children and families being comfortable coming back, but it's also our staff. You know, we are asking them, you know, to really go, you know, beyond what they're trained for and what they're typically used to. And you know, I think while children and families are coming in with some fears and anxiety, so are staff. So we're looking at how do we create right now strong training modules. We're doing a lot of virtual training. We're really rolling out our policies and procedures. We're starting to bring staff back next week so that we can start doing some in-person walkthroughs, you know, making sure that what's happening in the centers, we're trying it out first before we have little people with us, you know, and we're really looking at, you know, making sure that they feel comfortable. In that, we're going to be staggering our opening. We're hoping to open our doors for July 6th. So we will be doing 2 classrooms per site and location. That includes our school age sites as well, so that we can slowly bring people in, make sure that all of our policies and procedures are working, that everything is in place, and we can learn and adapt as we go. And hopefully by the end of July are in complete services. You know, I think another thing, you know, we talk about, you know, families needing to get back to work. Our staff are also needing to get back to work, you know, and they have childcare needs. You know, we did some surveying of our staff, you know, last month, and 39% of the staff that have responded have childcare, can't come back to work without childcare. So it is a significant need. You know, 74% of those needs, it's school age. You know, while we are facing a reduction, I think the greater reduction is to the school age programming across our community right now, and something we really have our eye on. Our family childcare, the independent family childcare providers can open at, they have a slight decrease in capacity, but we're really looking at how do we maximize the capacity that we have within that system. So right now we're in the throes of identifying all of our families that can come back, looking at where we have gaps and holes and capacity, and trying to just link as many families as we possibly can to those resources. So we are still accepting any family in need, you know, accepting applications and taking a look, doing that full review of what do they need. So if we can't even get them in center right now, we can have them on the radar and keep the remote work and support going with them. So, and the transportation is going to be interesting. We typically get 15 to 20 children on a bus. We're looking at 6. So right now our transportation director, who's already a whiz at routing, is you know, really honing in to try and see how can we get as many kids in, because that's often a barrier. Transportation is a barrier for children accessing our programs. So that's the highlight.
Yeah, no, it really is unbelievable. I mean, you all have turned into logistical experts overnight in terms of making these adjustments, ensuring safety protocols, and frankly, giving, you know, parents peace of mind as, you know, as they head back to work, right? I mean, this is a national issue that we're all contending with, but thank heavens that, you know, you're there and you know this. You know this business so well, and you all lead with your heart in terms of taking care of those children. My next question is for Carl. You know, community teamwork was one of the founding members of the Lowell Partnership to End Youth Homelessness, and you've worked over the years to alleviate homelessness for both families and for our young adults. Can you speak to the programs that are working and the challenges you're facing during this healthcare crisis?
Yeah, so the things that are working, you know, is really around supporting our youth where they're at. And so we even through this whole pandemic, we've had our site open. Our Youth Opportunity Center has been open on Monday, Wednesdays, and Fridays between 9 and 12. And now we're extending those hours to a full day, so that youth in the community do have access to our food pantry, do have access to our laundry and other hygiene facilities, as well as case management. It is by appointment only, but we're able to really schedule when those youth are coming in and receiving emergency services. What else is working is, we've really reallocated our funding to keep youth housed. And one of the ways that we've done that is when this pandemic happened, we had already placed a number of youth into stable housing. However, due to the pandemic, they either lost their job or were laid off, and that has had a huge toll on maintaining that stable housing for them and not getting them into arrears, which could lead to an eviction when the courts reopen. So, we've really diverted a lot of funds to supporting those youth to cover those kind of housing costs through this as well, so they don't fall back into homelessness. As well as us, food costs. For our youth build program, we've really quickly moved to an online educational system. As Karen has spoken about, our IT department really was essential in getting us to a place where we're able to do stuff remotely. And our staff were really quickly able to transition from doing stuff in a classroom to then engaging the youth via Zoom or Microsoft Teams to do some, classwork, do some educational components, and get them working towards their certifications from home, as well as I think we mentioned we've bought tablets and stuff that we're getting those in the hands of our youth and our families, so that they're still able to enrich themselves through educational components, whether that be within the school system they're in or through our youth programming.
Which is why the whole name of the game here is flexibility. When I hearken back to some of the first meetings we've ever had, it was making sure that the funding mechanisms we use are flexible, because no one knows the needs of the community and how dynamic they are better than you, and like being able to respond and not having to follow a rigid program guideline that's developed hundreds of miles away is what it's all about. So, and I know that you've been using some of those funds to give people the technology so that they can have access to enriching their education even over the summer months. So I'm down for the count, but Connie, we only have time for a couple more questions. So Connie, CTI, I know has received additional funding, not just from the federal government, but from the state government as well for rental assistance. Can you speak to what assistance is available and how people can access help? What are their qualifications that they, in order to receiving that help?
Absolutely. So, I think the key thing that we want to make sure everybody knows is that the key conduit to kind of access all of the housing supports and everything else is coming through our COVID specific communication channels. We've set up a COVID response hotline that people can call. It's 978-654-5607. They can call. It is messages are being pulled off at every couple hours. Right now, we've got about between a 24 to 48 hour response time, but that's kind of, so that's one quick way for people to get it, to get into the system and start their process. They can also do it via email. That email is let's see here, COVID response CTI@comteam.org. Again, all that information is right on our website, so people can get it very easily, and that's just comteam.org. And all of this information is available there. So as they go through that process, one of the key things is to kind of do the pre-assessment for their housing situation. We find, obviously this is it's always been a big issue. During COVID, it is become even more intense, and certainly more challenging for families as they're facing a lot of different economic realities. So we have seen increases from federal funding, from state funding, even city funding. And in addition to that, some private funding. we've received funding from United Way of Mass Bay, from the Greater Lowell Community Foundation, meant to be used to keep people safe in their homes, whether that's back rent or a stipend moving forward, or any of the other things that are necessary to keep a family housed. So between our traditional kind of RAFT funding, that's the rental assistance for family in transition, we also have some emergency services money that come into it. I think the key thing is that all of the different funding sources have their own individual eligibilities and criteria and different footprints. And, so it can be very complicated. And the key role that we can do, that we can play in the Housing Consumer Education Center, HCEC, is our housing counselors are able to take families through that whole process. Again, getting that big picture understanding of the family really helps us to be able to decide what funding source is available, which is most appropriate for that specific family. And, because of the generosity of a lot of, again, private foundations and individuals, we do also have some unrestricted funds when you just can't make it fit, when you just can't make something fit. Here at Community Teamwork, we do have additional options, because we recognize that, again, in uncharted waters like this, expecting every crisis to fit into the same cookie cutter kind of situation just isn't realistic. And our ability to be nimble and flexible and provide those resources in a lot of different ways, I think is really the key to ensuring that families and individuals make it through this critical time.
That's terrific. So Karen, last question. What do you see as the greatest need in our communities moving forward? And then what would be the best way for, town or municipal leaders to refer people to community teamwork?
So, it is interesting. We've seen shifts in needs. Our immediate needs were food. We had buses delivering 850 meals a day. And then we added dinners because that was a need. The rental and mortgage assistant need seemed to spike like week 2 and 3 into the crisis. And that will continue. We know that will continue. The data we're seeing throughout the state points to an impending housing crisis. We already were in one. Before COVID, 48% of the people living in the city of Lowell were rent burdened. We know that number is going to skyrocket, right? And that as the moratorium ends, as Connie said, rent and mortgage assistance will continue to be a need of the community. Also, connection with education, training, and jobs, right? If you've lost a job, you really are going to need assistance in connecting with that. And we will be using some of our funds to enhance the work we're doing to connect people to education, training, and jobs in a new environment. And I think we have to be flexible and nimble to be able to do that as that need. But I do see that need going on for the next several years, in addition to the housing crisis, which already we're in a market with very limited stock and very high prices. So I think those things will continue. And I also have to say, as the kind of agency that we are, we're also committed to doing the work to confronting and ending racism. That has been front and center for all of us. We're committing our agency to do better and to also bring that work to the community. When the first line of your mission statement is you're committed to systemic change and to make our conditions better, then we take that seriously, as does our board. So that work also will go forward. And I think all of these have to come together to really look at closely the needs and conditions in our community, the health issues, and how we can all come together to make an impact on that. And we work closely in partnership, as you know, Laurie. All of our work is in partnership. We will continue to do that, to be partners with other agencies, with communities, with anyone. We work with municipal government, state officials, people in the community, and we'll continue to do that. And I think for communities, reach out to me. I can figure out how to help navigate. kfrederick@comteam.org. I'm always happy to answer an email. And I think sometimes people just don't know where to start. Sure. A lot of local officials get calls. And You know, you could be on a board of selectmen or a city council or a school committee. I encourage people, get those to us. We will help. And if you don't know how to navigate the system or who to get it to, send it to me or one of us, and we will help with that. Because, you know, we are getting back to our calls. We're doing, I know, a great job, but occasionally things can fall between the cracks, and we want to make sure people follow up if that does happen, and we can get the answers that people need and the programs connected to the people that need them.
Well, I so treasure all that you do, right? I mean, you all have been filling in the gaps, standing in the gap, and you, just the nobility that you show up with each day, you know, living and working your mission. I get to see it up close, more than most, and you know, we couldn't ask for better partners in terms of, you know, just really changing the trajectory of, you know, a situation in that when it hits a family. And this crisis has just hit so many people in our community. So thank you for that. And thank you for joining today. For those of you who are interested in the resources and the services that were discussed today, please don't hesitate to reach out to Community Teamwork. Going online, as Connie said, to the website comteam.org. That's COMMTEAM.org. They have a list of their services with the appropriate number for folks to call. So please don't hesitate to call them, use them as a resource. And additionally, for an easy way to stay updated on, you know, the federal and state response to COVID-19, as well as any information on future teletown halls or Facebook Live events that we're doing, definitely follow us on Instagram, Facebook, and Twitter at Rep. Lori Trahan. You can also go to our website, trahan.house.gov/COVID-19 for resources that are important to you, your family, your small business. I'm just going to close by thanking you all again. Thank you everyone for tuning in. Your commitment to staying informed and keeping yourselves and your loved ones safe is what has allowed us to make it this far in the fight against COVID-19. We're not out of the woods yet. Our emergency personnel are still working day and night to save lives. They're relying on us to continue doing our part to keep them safe and healthy. So please continue keeping a safe social distance between you and others when you're out. Wear that mask. If you can't maintain that 6-foot separation, or if you know you're heading into a grocery store or another building, keep washing those hands frequently and thoroughly. And every day that we continue doing our jobs to slow the spread of this virus is one day closer to us getting back to a sense of normalcy. So thank you all again. Thank you for everything you do, Community Teamwork, and stay safe, stay well. Bye.
Thank you. And thank all your
Thank you.
staff.
So very
Thank you
much.
so much.